Welcome to our exploration of a unique neurological condition, Saturday night myelopathy. Myelopathy is a disorder involving the spinal cord, often presenting with a variety of symptoms and causes. It can be challenging to diagnose due to its diverse presentations. Today, we'll focus on a rare form known as flexion myelopathy, particularly when it is related to drug intoxication. Understanding this condition is crucial for clinicians and patients alike, as early recognition can significantly impact outcomes. Let's begin by understanding what myelopathy is and why it's important to recognize its less common forms. Flexion myelopathy refers to spinal cord injury that occurs when the neck is bent forward for an extended period. This position can compress the spinal cord, leading to neurological symptoms. While often associated with surgical procedures, flexion myelopathy can also result from other scenarios, such as unconsciousness due to drug intoxication. Recognizing the mechanism behind this injury helps us understand why certain patients are at risk and how to prevent long-term complications. Let's look at a real-life case that highlights the dangers of flexion myelopathy. A 20-year-old woman was found unconscious after polysubstance drug intoxication. During her period of unconsciousness, her neck remained in a flexed position for a prolonged time. When she regained consciousness, she experienced sudden weakness in her legs, a condition known as acute paraparesis. This case underscores how quickly neurological symptoms can develop in vulnerable situations. Upon presentation, the patient's main symptom was acute paraparesis, meaning she had significant weakness in both legs. This sudden onset of weakness after a period of unconsciousness raised immediate concerns for spinal cord involvement. The clinical team quickly recognized the need for imaging and further investigation to determine the underlying cause. Early identification of such symptoms is vital for prompt treatment and better recovery. Imaging studies, such as MRI, revealed extensive signal changes in the cervicothoracic region of the spinal cord. Additionally, there was hyperintensity in the posterior neck muscles, indicating muscle involvement. These findings were crucial in narrowing down the diagnosis. The combination of spinal cord and muscle changes pointed toward a flexion injury rather than other possible causes. Imaging plays a pivotal role in diagnosing complex neurological conditions. To ensure an accurate diagnosis, the medical team conducted a thorough workup to rule out other potential causes of the patient's symptoms. Tests for infections, autoimmune diseases, and other neurological disorders came back negative. This comprehensive approach is essential in medicine, as it helps avoid misdiagnosis and ensures that the patient receives the most appropriate treatment for their specific condition. With other causes excluded and imaging findings supporting the diagnosis, the patient was diagnosed with flexion myelopathy. This diagnosis explained her sudden leg weakness and the changes seen on her MRI. Recognizing flexion myelopathy, especially in the context of drug intoxication and prolonged unconsciousness, is vital for timely intervention and improved outcomes. The patient was promptly started on a course of steroids, which are commonly used to reduce inflammation in the spinal cord. Early treatment is key in neurological injuries, as it can help limit permanent damage and promote recovery. The use of steroids in this case led to a marked improvement in the patient's symptoms, highlighting the importance of rapid medical intervention. Following steroid treatment, the patient experienced significant improvement in her leg strength and overall function. This positive outcome demonstrates the potential for recovery when flexion myelopathy is identified and managed quickly. Rehabilitation and supportive care also play important roles in helping patients regain their independence after neurological injuries. Flexion myelopathy occurs when the spinal cord is compressed due to prolonged neck bending. In cases of drug intoxication, patients may lose consciousness and remain in positions that put their spinal cord at risk. The lack of movement and awareness during unconsciousness increases the likelihood of injury. Understanding these mechanisms helps clinicians anticipate and prevent similar cases in the future. Imaging, particularly MRI, is essential in diagnosing flexion myelopathy. It allows doctors to visualize changes in the spinal cord and surrounding muscles, which are not always apparent through physical examination alone. In this case, the imaging findings were key to confirming the diagnosis and guiding treatment decisions. Advanced imaging techniques continue to improve our ability to detect and treat neurological conditions. Early recognition of flexion myelopathy can make a significant difference in patient outcomes. Delayed diagnosis may lead to permanent neurological deficits. Clinicians should maintain a high index of suspicion in patients with risk factors such as drug intoxication or prolonged unconsciousness. Prompt assessment and intervention are key to preventing long-term disability. Drug intoxication can lead to a range of complications, including neurological injuries like flexion myelopathy. When patients are unconscious, they are unable to protect themselves from harmful positions. This case serves as a reminder of the broader risks associated with substance abuse, emphasizing the need for awareness and prevention strategies. One unique aspect of this case was the signal change in the patient's neck muscles seen on imaging. These changes provided an additional clue that helped clinicians reach the correct diagnosis. Paying attention to subtle findings on imaging can be the difference between a missed diagnosis and timely treatment. This case offers important lessons for healthcare providers. Always consider flexion-related myelopathy in patients with sudden neurological symptoms after drug intoxication or prolonged unconsciousness. A thorough history, careful examination, and appropriate imaging are essential steps in the diagnostic process. Being vigilant can help prevent misdiagnoses and improve patient care. Educating patients about the risks of drug intoxication and the importance of avoiding prolonged unconsciousness in unsafe positions is crucial. Prevention strategies, including substance abuse counseling and safety measures, can help reduce the incidence of flexion myelopathy and similar injuries. Empowering patients with knowledge is a key aspect of modern healthcare. Managing complex neurological cases often requires a multidisciplinary approach. Neurologists, radiologists, rehabilitation specialists, and nurses all play important roles in patient recovery. Collaboration ensures that patients receive comprehensive care, from diagnosis through rehabilitation and follow-up. Rehabilitation is a critical component of recovery for patients with flexion myelopathy. Physical therapy, occupational therapy, and psychological support help patients regain function and adapt to any lasting changes. Support from family and healthcare providers is essential for optimal recovery and quality of life. With timely diagnosis and appropriate treatment, many patients with flexion myelopathy can achieve significant recovery. However, some may experience lasting neurological deficits. Ongoing follow-up and support are important to address any long-term challenges and to monitor for potential complications. To summarize, Saturday night myelopathy is a rare but serious condition that can occur after drug intoxication and prolonged neck flexion. Early recognition, prompt imaging, and rapid treatment are essential for the best outcomes. Clinicians should remain vigilant, and patients should be educated about the risks and prevention strategies. Flexion myelopathy related to drug intoxication is a reminder of the complex interplay between lifestyle factors and neurological health. By staying informed and proactive, both clinicians and patients can work together to prevent and manage these challenging cases. Thank you for joining us on this journey through a fascinating and important medical topic.